Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, welcome back to Redefining Medicine. And today in Boston, we have Dr. Jaclyn Chasse-Smeaton, and she's a naturopath, and she's excited to talk to us about the expansion of A4M into areas of infertility. So, Dr. Smeaton, nice to meet you. Talk to us about it.
Tell
us.
Yeah, thanks for having me here. Yeah, I was so excited when A4M invited me to be a part of the faculty here at BHRT to talk about infertility. I've attended BHRT for a long time, and it covers primarily perimenopausal and postmenopausal women. So pulling it back to reproductive age and starting to talk a little bit more about how clinicians can help couples trying to conceive is really exciting to me because that's my true love clinically. And there's also just so many people who need help with it.
True. I'm very happy because, as you know, I go from the beginning, from out of utero.
Yep.
So tell me how you do it, because you're a naturopath. So give us some information about what you're teaching and how do you do this?
Yeah, sure.
Tell us.
So probably not surprisingly, a lot of this is like proactive preparation. How to work with couples that think they want to conceive in the next 6 months to a year to help them optimize their nutrition and their lifestyle and eliminating exposure to toxins and stress and all those fundamental pieces. But what I think is really nice for A4M is that everything that I've ever been taught about anti-aging is very relevant to couples that are trying to conceive, because the ovaries in particular are one of the first organs to start to see signs of aging. For men, we also know that infertility is very highly correlated with adult chronic disease risk. So infertility might be the canary in the coal mine for men as well. So it's really important when we think about the entire lifespan to focus on this time. But you think about things like oxidative stress, mitochondrial dysfunction, and all these fundamental concepts that probably many A4M practitioners have learned about and studied, but with a completely new application.
I think that's great. So who comes to you? Give me an example of how do you get your patients? How do they come? So the doctors, the providers who are watching, can actually understand what their focus should be, how to help these patients.
That's a great question. So the majority of my patients are actually older patients, I would say 35 and up, which we call geriatric, right, at that age, which is
sad.
So sad, so sad. But it's the point where couples start to struggle a little bit with conception. Sometimes I get couples who are there because they want to prepare and be proactive, and I love that. But I would say 95% of my practice is couples who are at the end of their rope. Most of them have tried IUI, they've tried IVF, and they've had failures or recurrent miscarriage. So I tend to get the worst cases in my practice. And they might have been even turned away from IVF because their hormonal labs looked so off that they weren't a good candidate. So it's really helping couples dig a little bit deeper to find the root cause of what's going on and helping them overcome it or just maximize the health. When it comes to fertility, the other thing that I always think about is that this is passing on the DNA for your future child. So it's not just about getting pregnant. That's not the end point to me. As you know, you want, as a parent, to have children who are really healthy. And so it's about optimizing the health of both parents, to optimize their chances of pregnancy, but also their likelihood of having a healthy baby.
It couldn't be any more right, obviously. And so how do they find you?
My practice is completely virtual. It's called Hello Fertility. So most people stumble into me online, or they see a doctor for general medicine, like general functional medicine, and they get referred over to me. because that clinician kind of used all the tools they had in their tool belt. But you can find me online at Hello Fertility.
It's interesting because I was thinking about how would a conventional couple who's gone through, like you said, IUI and IVF, trying to conceive and needing your support, which clearly you don't have to have problems, but these people already have problems. They already have these issues. They need you to supplement what's going on to help them. Would an IVF or an infertility clinic even know that there's such a thing as helping them, the couple, with diet, exercise, lifestyle,
Good
stress
question.
management?
So I would say some clinics that are more conventionally oriented, no, but believe it or not, like if you open up fertility and sterility, almost every single month, there are studies that look at what I would consider functional medicine. They're either studying nutrients or the effect of mitochondrial support. You know, even the fundamental teachings we have around egg quality and around ovarian reserve, it's functional medicine in nature. It's the things that impact it are oxidative stress, mitochondrial dysfunction, and telomere shortening, and then low androgen levels. So every single one of those things that's published in mainstream literature are things that we address with functional medicine. So the concepts are there, the practice isn't quite there. Although it's becoming more popular where clinics are doing more restorative or rejuvenative therapies, and some are even experimenting with things like stem cells and PRP and things like that in the fertility world.
All right, but that's like going 10 steps ahead,
10
right?
steps.
How do you get them to actually bring you in while they're working with their patients?
That's a great question. I mean, there are clinics that are starting to utilize nutrients like CoQ10. That's one example of, or DHEA is another one. In Europe, 75% of clinics prescribe DHEA for couples trying to conceive for women. And so there's little tiny entrance points. But really what it comes down to for me, the relationships I've built in the conventional space have come from patient care and seeing their patients improve when they're co-managed. And that is what opens the door to them calling and saying, hey, let's grab lunch, or I'd love to learn more about what you do. And then those clinics become more referral streams. But ultimately it comes down to them witnessing hopeless cases get pregnant with the support of both my care and their care.
Of course.
A lot of times IVF is still needed. We can just help it go a little bit better.
Right, that's what I was thinking about, that it's a cooperative effort.
Absolutely.
And with the understanding, like A4M is not alternative medicine. It's not anti-conventional medicine or, you know, complementary medicine. What it is, it's about bringing together all the pieces we have in the service of the patient. And what you're talking about is really great because the patients you're talking about are the ones that will benefit the most, the quickest from putting together the conventional with the integrative way of putting it together.
You're absolutely right.
So what's your success rate? So how often do you get patients who, they're, you know, like you said, they're giving up, they're done, and then they come to you, you tweak their diet, you do everything. So how often do they
so we
get
don't
pregnant?
do formal tracking, but we did do a chart review because we were curious about this, and we had about 70% of couples get pregnant in 1 year. And that's pretty remarkable. Like most IVF clinics have about a 40% success rate. So in this case, they may still have been doing IVF, but with the combination of support, and many get pregnant on their own, some with twins, believe it or not. We get about a 70% success rate. So that's really promising
That's
for people.
huge. So shouldn't that be published in all the conventional medical journals?
Yeah, it should be. I need to get back on better data traceability and standardization there.
Yeah, well, that's why you want to cooperate with the conventional people and say, listen, we can help you. We can actually make your success rate better so your numbers will look better.
Absolutely.
All right?
Yep.
That sounds wonderful.
Yeah.
Wonderful. Well, thank you so much.
Thanks for having me.
And it's great to hear that we are expanding and that we have people like you to help us expand.
Great. Nice to
Thank you.
Thank you.